Welcome to Addiction Rescue Inc.'s series, Inside the Mind, a deep dive into mental health, where we explore mental health disorders in depth and offer insights into managing them. In today's episode, we're diving into Attention Deficit Hyperactivity Disorder, or ADHD, a neurodevelopmental disorder that affects millions of people worldwide. Whether you or someone you know is living with ADHD, this episode will provide clarity on the symptoms, challenges, and treatment options. Let's get started. Section 1. What is ADHD? ADHD is a neurodevelopmental disorder characterized by patterns of inattention, hyperactivity, and impulsivity that are more severe than what is typically observed in individuals of a similar developmental level. This disorder impacts both children and adults, though it often presents differently as people age. According to the Centers for Disease Control and Prevention, CDC, about 5% of adults and 9.4% of children in the U.S. are diagnosed with ADHD. It's worth noting that ADHD is not just a kid's disorder. Many adults who struggle with ADHD may have been undiagnosed as children. Let's break ADHD down into its three types. 1. Inattentive type. This manifests as difficulty paying attention to details, maintaining focus, and following through on tasks. 2. Hyperactive impulsive type. Those in this category exhibit excessive movement, fidgeting, and impulsive decision-making. 3. Combined type. Most individuals diagnosed with ADHD fall into this category, where both inattentiveness and hyperactivity impulsivity are present. The understanding of ADHD has evolved significantly over the years. It was once thought to only affect children, and it was often misunderstood as a result of bad behavior. However, research now shows that ADHD has a biological basis, involving differences in brain structure and chemistry, particularly in how dopamine is regulated. Section 2. Symptoms and diagnosis. Let's look at the symptoms in more detail, starting with children. Kids with ADHD often struggle in school, showing signs of inattentiveness, like not listening when spoken to directly, difficulty staying organized, or losing things necessary for tasks. On the hyperactive side, children might squirm in their seats, run around inappropriately, or interrupt others during conversations or games. Adults with ADHD might have similar symptoms, but they often appear differently. Forgetfulness, chronic lateness, difficulty prioritizing, and frequent job changes are common. They might experience emotional dysregulation, which can lead to conflicts in personal relationships or workplace misunderstandings. The diagnostic process is comprehensive. ADHD cannot be diagnosed based on a single test. Clinicians typically use behavioral evaluations, self-reports, interviews, and sometimes even brain scans to assess symptoms. It's crucial to rule out other disorders like anxiety, depression, or learning disabilities, which can present similarly. One of the most commonly used tools in diagnosing ADHD is the DSM-5 criteria, along with specific rating scales like the ADHD Rating Scale 4. These evaluations focus on how often behaviors occur and whether they are affecting day-to-day life. Section 3. Challenges of living with ADHD. Living with ADHD presents unique challenges, especially in environments that demand attention to detail and strong organizational skills like school and the workplace. And many people with ADHD struggle with time management, often referred to as time blindness, where individuals have difficulty judging how long tasks will take or keeping track of time. For children, school can be particularly tough. They may underperform academically, not because they lack intelligence, but because they have trouble focusing or staying on task. This can lead to feelings of frustration, both for the child and the teachers. For adults, juggling multiple tasks or responsibilities at work can feel overwhelming. In personal relationships, ADHD can also cause strain. Partners of those with ADHD may feel as though they're shouldering more of the household responsibilities, while individuals with ADHD may feel misunderstood or unappreciated for their efforts. A study from the National Institute of Mental Health shows that untreated ADHD can lead to other complications, including substance abuse, depression, and anxiety. Adults with ADHD are also more likely to experience financial difficulties, have multiple job changes, or struggle with self-esteem due to years of untreated symptoms. The good news is that ADHD is highly treatable. The two main approaches are medication and behavioral therapy, often used in combination for the best results. Medications. The most well-known treatments are stimulants like Adderall and Ritalin, which help boost levels of dopamine in the brain, improving attention and focus. There are also non-stimulant medications available for those who may not respond well to stimulants or prefer another option. It's important to work with a healthcare professional to find the right balance, as each individual responds differently to medication. Behavioral therapies. Therapy can help individuals with ADHD manage their symptoms. Cognitive behavioral therapy, CBT for instance, focuses on changing negative thought patterns and behaviors. ADHD coaching is another useful resource where trained coaches work with individuals to develop practical strategies for time management, organization, and goal setting. Practical tools. On a day-to-day level, there are strategies that individuals can use to make life more manageable. Apps like Todoist or Google Keep can be used to create task lists and reminders. Breaking tasks into smaller steps and using visual or auditory cues can also help individuals stay on track. For parents, behavioral interventions such as positive reinforcement and consistent routines can be incredibly helpful in managing a child's ADHD symptoms. Section 5. Breaking the stigma. Unfortunately, despite advances in understanding ADHD, there is still a significant stigma attached to the disorder. Many people still believe that ADHD is an excuse for laziness or bad parenting. This couldn't be further from the truth. Many highly successful people live with ADHD, including entrepreneurs, athletes, and entertainers. Understanding the unique strengths that come with ADHD, such as creativity, innovation, and hyper-focus on tasks that spark interest, can help shift perspectives. As awareness grows, it's essential that we continue to challenge outdated stereotypes and offer support, not judgment, to individuals with ADHD. Schools, workplaces, and families must foster environments where people with ADHD can thrive. Thanks for watching this episode of Inside the Mind, a deep dive into mental health. If you found this video helpful, please like, subscribe, and share it with others who may benefit. Feel free to comment below with any questions or suggestions for future episodes. Together, let's continue to spread awareness and understanding of mental health challenges.